So for this video, we're going to be talking through Craig's test, which is an assessment of femoral anteversion and retroversion. Now, the setup for this is to have your patient in a prone position with the knee flexed to approximately 90 degrees. And so let's go ahead and begin. As we flex our patient up to 90 degrees, our next step is to ensure that we're opposite the hip. Now, the reason why this is beneficial is if you're pressing in on the same side as the hip, oftentimes your hand is not going to necessarily give you good palpatory feedback in terms of where that greater trochanter is as you move between internal and external rotation. In essence, you want your hand to be as flat as possible such that when you come and palpate for that greater trochanter, you can find the location through that arc of motion where it is most lateral. And when you find that, so first and foremost, find the greater trochanter, then you're going to move the hip back and forth between internal rotation and external rotation. Find the position where it's most lateral, which is about there for this individual. Then you're going to hold that position, snag your goniometer, and then take a measurement. Now in this position right now, this individual is in slight internal rotation. The mobile arm is in line with the tibia. The stationary the stationary arm is vertical, and then we can ask our patient to relax. Now for this individual has approximately 9 degrees of femoral internal rotation when that greater trochanter is most lateral. If the angle is somewhere around 8 to 15 degrees in the direction of internal rotation, we consider that to be normal as the femoral head and neck adopts a slightly anteverted position. Where we begin to be concerned is if it eclipses 15 degrees, meaning it is in excessive anteversion, or if it is in an externally rotated position, that being more a retroverted position. Obviously, we would want to correlate this with clinical findings, and if this was concerning, it would warrant further medical diagnostics with orthopedic consult to follow up. But again, have a go with this test. Ensure you're on the opposing side of your reference limb. You're able to palpate and find the greater trochanter, its location when it's most lateral. Take the individual through an arc of motion of internal and external rotation, and then take your measurement. Have a go with a peer or colleague and let me know if there's any questions.